Finding the right healthcare coverage for you and your family, it's overwhelming, to say the least. As open enrollment season begins for health insurance, resources are available to help find the right plan for your specific needs. So here to discuss is the Chief Executive Officer for Individual and Family Plans at United Healthcare, Marcus Robinson. Good morning.
Good morning. Happy to be here.
Thanks so much for joining us. What are the individual and family plans, family ACA plans? Who qualifies for this? Just kind of break it down for us a little bit.
Sure, absolutely. Individual and family plans are plan designs that are made available on the health insurance exchange or marketplace. It's a place where individuals can go and shop for coverage and find the coverage that best fits their individual and family needs. Additionally, you qualify if you live or reside within the United States and you do not have coverage through an employer, through Medicare, Medicaid, or CHIP programs as well.
If somebody doesn't have access through an employer, though, a lot of people just automatically think that they can't afford this. Affordability is a major factor for everybody in our country. So are there any resources that could help people, or is that a misunderstanding that it's unaffordable? What are some of the prices and the resources that we're looking at?
Absolutely. Let's first address your question around affordability. Affordability is key, and it's something that we are always focusing on at United Healthcare. On our plan designs, this upcoming open enrollment, we have focused on portions of the plan that people access the most frequently, such as going to their physician. We have $0 primary care office copays on many of our plan designs, low cost and affordable prescription drugs, $5 for many of our tier 1 drugs in a wide range of pharmacies across the country. And specific to the Houston market, we're really excited about partnering with the Kelsey System clinics across the greater Houston area to provide affordable coverage, high quality care over the 35 locations across Houston. Lastly, on affordability is the plan designs themselves. On the Kelsey System product, we are excited to have $0 deductibles and a copay focused plan, which brings a lot of predictability for individuals' costs. Additionally, within the marketplace itself, many are eligible for subsidies and premium assistance. 90% of individuals qualify for some level of subsidy, and according to the Centers of Medicare and Medicaid Services, that average subsidy premium tax credit was $500 a month.
Yeah, I didn't know that about partnering with the Kelsey System. People here in Houston love the Kelsey System, so they're definitely going to want to buy into that. But when do they get that $0 copay that you're talking about? When can they get that type of plan, and how do they get it?
Yeah, so if you go on the exchange, and open enrollment begins November the 1st, and you can look in the name of the plan itself, you'll see Kelsey System in the naming convention of the plan design. You'll be able to shop very easily and compare both primary care copays, specialist copays, and deductible amounts as well. And again, specifically on that Kelsey System partner plan design that we have, we're excited to have $0 deductibles on all of our Kelsey System plans, and then you'll see the copay amounts after that.
On the ones that are $0 deductibles, though, what are they paying like in a year or something like that? Do you have an estimate on that?
It just depends on your overall services. We have metallic levels that range between gold and bronze, and there's out-of-pocket maximums within each of those metallic levels. The medical deductible itself is $0, but the predictability on the copays depend on the level of services. Inpatient, outpatient, and also pharmaceuticals as well. You'll be able to shop very easily and compare those options throughout the plan designs.
Yeah, I like when you say easy, because this is when it gets a little bit tricky when people see the gold and the bronze. So what do they need to think about when they're shopping for their family? What do they need to know that they're looking for between these plans?
Yeah, so insurance and also healthcare is both individual, local, and personal. So I suggest anyone that is going through that buying decision in that process to know what your healthcare needs are going to be for the upcoming year. So if you have a relationship with a provider, if you know how often you are going to the doctor, or if you have some outpatient needs coming up, those are good reasons and good things to look at when making those comparisons. Additionally, there are value-added benefits that many plan designs offer. We are excited to offer virtual wellness classes at no cost with a partnership with OnePass on our plan designs. And we also have member incentives where you can get up to $100 on a Visa prepaid card for doing activities around wellness and account activation as well. Those are just some of the things that we offer, but you'll want to also compare that with other plan offerings on the exchange. And we've got a team of individuals that would love to help you with those buying and decision-making processes as well.
All right, Marcus Robinson with United Healthcare. Thanks for joining me this morning. A lot to think about before we can start enrolling tomorrow. Thanks so much.
Thank you. Happy to be here.